Did you know that belly fat isn't just about how your genes fit, it can actually shrink your brain and increase your risk of death? Yes, this isn't just a cosmetic issue, it's a serious medical concern. But the good news? You can lose it fast and safely. Today, I'll show you exactly how. Hi, I'm Dr. Aria Wells, and in this video, I'm breaking down the real science behind burning belly fat fast, no gimmicks, no detox teas, just evidence-based strategies that actually work. If you've been frustrated by stubborn belly fat that won't budge, stick with me. What you learn in the next few minutes could literally change or even save your life. Let's start with a truth many people overlook. Belly fat, specifically visceral fat, is not the same as the soft, pinchable fat just under your skin. Visceral fat surrounds your internal organs, including your liver and pancreas. It's biologically active and releases inflammatory chemicals that increase your risk of heart disease, type 2 diabetes, and even dementia. A study in the Journal of the American College of Cardiology found that visceral fat, regardless of your overall weight, is directly linked to a higher risk of death. In my clinic, I've seen patients who lost just a few inches off their waist completely reverse their prediabetes or cholesterol issues. That's how powerful belly fat loss can be. So how do we tackle it? Let's break it down into the 7 science-backed levers you can pull to burn belly fat fast. Number 1. Insulin. First up is insulin, a key hormone that regulates blood sugar but also doubles as a fat storage switch. When you eat foods high in sugar or refined carbs, your blood sugar spikes. In response, your body releases insulin to shuttle that sugar into your cells. But consistently high insulin levels signal your body to store more fat, especially in your belly area. Over time, this leads to insulin resistance, where your cells stop responding effectively to insulin. Your body compensates by producing even more, and the fat-storing cycle continues. A landmark study in diabetes care revealed that reducing insulin levels, not just total calories, leads to significantly more abdominal fat loss. The takeaway? To lose belly fat, you have to lower insulin. That means cutting sugar, processed carbs, and replacing them with whole, low-glycemic foods like lean proteins, non-starchy vegetables, nuts, seeds, and healthy fats. It's not about eating less, it's about eating smarter. Number 2. Strength training. Cardio is great for your heart, but when it comes to melting belly fat, resistance training is where the magic happens. Muscle is metabolically active, meaning the more muscle you have, the more calories you burn even while sleeping. And studies show that strength training specifically targets visceral fat more effectively than cardio alone. A Harvard study tracking over 10,000 men found that those who added just 20 minutes of weight training per day had significantly less age-related abdominal fat compared to those doing cardio alone. In practice, I had a 2-year-old female patient start doing 3 sessions of bodyweight exercises per week: squats, lunges, and push-ups. In just 10 weeks, she lost over 4 inches off her waist, with no change to her calorie intake. Start with compound movements that work multiple muscle groups: squats, deadlifts, rows, and push-ups. You don't need a gym membership, just your body weight and some consistency. Number 3. Sleep. You can be eating clean and exercising daily, but if you're not sleeping well, belly fat will stick around. Sleep deprivation increases ghrelin, the hunger hormone, and decreases leptin, the hormone that tells your brain you're full. It also raises cortisol, a stress hormone we'll talk about in a moment, which drives fat storage in the belly. One study in the journal Sleep found that people who got less than 6 hours of sleep per night had waistlines that were, on average, 1.5 inches larger than those who slept 7 to 8 hours. I had one patient who plateaued for months until we addressed her sleep schedule. After just 2 weeks of getting 7.5 hours consistently, she started losing again without changing anything else. If you're not getting 7-9 hours of high-quality sleep, start there. Make your room cool, dark, and screen-free before bed. Magnesium glycinate, herbal teas like chamomile, or apps with guided sleep meditations can all help you wind down naturally. Number 4. The cortisol connection. Let's talk about stress, because your brain can't tell the difference between a deadline and a tiger. Chronic stress raises cortisol, which tells your body to store energy as fat for survival. And guess where it stores it first? The belly. Cortisol increases appetite, particularly for sugar and high-fat foods. A study in psychosomatic medicine showed that women with high cortisol levels were significantly more likely to have abdominal obesity regardless of calorie intake. I once worked with a busy CEO who worked 80-hour weeks, exercised regularly, and ate healthy, but she couldn't lose belly fat. After implementing daily meditation and cutting back her schedule by 10 hours a week, she dropped 10 pounds in just over a month. Even 10 minutes a day of mindfulness, breathing exercises, or simply walking in nature can lower cortisol. You don't have to quit your job, just build in moments to decompress and switch off fight or flight mode. Number 5. Protein and intermittent fasting. What you eat matters. but when you eat can be just as powerful. High-protein diets help you feel full longer, reduce cravings, and increase your metabolic rate. Intermittent fasting, such as the 16-to-8 method, naturally reduces insulin levels, allowing your body to shift into fat-burning mode more efficiently. A 2020 review in Obesity Reviews found that intermittent fasting significantly reduced waist circumference, even in people who didn't count calories. I've seen this firsthand. One patient began eating within an 8-hour window each day while prioritizing protein-rich meals, think eggs, fish, beans, and Greek yogurt, and lost 3 inches off her waist in just 30 days. Start with a 12-hour overnight fast and work your way up to 14 or 16 hours. Combine that with 25-30 grams of protein per meal, and you'll feel more energized and less hungry between meals. Number 6. Gut health. Here's something that's gaining a lot of attention. Your gut bacteria play a major role in how you store fat. People with a diverse, healthy microbiome tend to be leaner. Certain bacteria improve insulin sensitivity, reduce inflammation, and help regulate appetite. A pivotal study in Nature found that people with lower gut microbiome diversity had significantly higher visceral fat and metabolic dysfunction. In my clinic, I've helped patients reduce belly fat and bloating by adding more prebiotic fibers like oats, garlic, onions, and fermented foods like sauerkraut, kimchi, and kefir. Start by adding just one gut-friendly food per meal. You can also consider a multi-strain probiotic supplement, especially if you've taken antibiotics or have digestive issues. Number 7. Alcohol. Let's not forget the silent saboteur, alcohol. It's metabolized differently than carbs or fats. Your body treats it like a toxin, so it prioritizes burning alcohol first, meaning fat burning gets paused. On top of that, alcohol lowers your inhibitions and increases cravings for salty or sweet snacks. Even moderate drinking has been linked to increased belly fat. A study from the Journal of Nutrition showed that women who drank moderately had a significantly higher waist circumference over time. I've had patients lose stubborn belly fat simply by reducing alcohol to once or twice a week. If you're drinking several times a week, try cutting it down. When you do drink, go for low-calorie options like vodka with soda water or dry red wine, and always drink with food to reduce blood sugar spikes. The truth is, belly fat isn't permanent. Your body wants to heal, it just needs the right inputs. I've seen patients in their 30-second, 40-second, even 70-second reverse insulin resistance, flatten their waistlines, and feel better than they have in decades. And we're just getting started. In my next video, I'll explain how to fix a slow metabolism, especially if you feel like your age or hormones are holding you back. So hit subscribe, give this video a thumbs up, and share it with someone who could use a little science-backed motivation today. Until next time, take care of your body, and it will take care of you.